What do you think of metabolic syndrome, the way it's presented by today's medicine, modern medicine, and functional medicine? So, how do we merge them together? What do you think?
Wow, it is such a common problem these days with the obesity pandemia. It's been getting worse and worse, and some people that are not considered obese have metabolic syndrome. But and for some people that don't know, metabolic syndrome includes certain criteria like high blood pressure, like high triglycerides, low good cholesterol, and a certain abdominal circumference for men and women. And it is the basis for insulin resistance. Everybody that has metabolic syndrome has insulin resistance, so they're resistant to insulin, and their sugar levels spike. And it is so much related to inflammation and oxidative stress in our body, which we cannot avoid basically, but we can find out exactly how well our body works against that and empower our body with the right tools. And inflammation is huge. And metabolic syndrome is related to so many problems because one of the keys, hormones that is involved in glucose metabolism and weight management, management is GLP-1. And that is produced in the intestine. And if the intestine doesn't work properly, you will not have the right production of GLP-1 and many other hormones. And nobody's paying attention to that way. And of course, I think GLP-1 is on everybody's lips, because everybody's been trying it for either diabetes or for weight loss, but not to think about it as a hormone that we actually should be producing enough of in the proper conditions. And metabolic syndrome drives so many other diseases, and it should really be, we should have a solution to it. And we do, if we approach it comprehensively, holistically, like we all do. What do you think?
Yes. So, well, first of all, metabolic syndrome, I think it's the, like you said, it's the beginning of inflammation. It's the root of inflammation, or root of metabolic syndrome comes from inflammation. And inflammation is the root of all the diseases. Basically, inflammation creates everything, all the diseases that we have. So I always explain to my patients saying that there's 3 factors that create diseases in our world. It's a nutritional deficiencies, it's the lifestyle deficiency, and it's a deficiency of activating your specific genomics. Okay, so those 3. So nutritional deficiencies, I don't know how much of people you see with deficiencies of vitamins like vitamin D. It's such a common condition today, and it's almost considered normal. When I tell my patients you're deficient in vitamin D, they go, everybody's deficient in vitamin D. So what does that mean? So it became norm. Okay, that's nutrition. The food that we eat, it's not nutrient dense food. So even if you're eating salads, they're not dense in nutrients and microelements like we used to have before, because the soil is depleted. There's so many factors play a role. And then you think you're taking your vitamins, you're supplementing with something. Are they really vitamins that you take? Number one, what the quality of the vitamins? And then you're supplementing it, but you really feeding your body if you're supplementing? You see? So that's also important. So nutrition is important, not only the dosages of vitamins, but the type of the vitamins according to your genetics. Okay. And also, do they activate specific genomic triggering systems, pathways in your body? Okay, that's important. Whether you're taking it as a supplementation, whether you're taking it from the food, it doesn't matter. The purpose of the food is to activate those things, those pathways. Then we're talking lifestyle deficiency. Of course, everybody's trying to move, everybody's running, everybody's going to gym. But it's not only that. People talk about this. Oh, I go to the gym, I run, I do lift weights. Good for you. But also, what is happening with your thinking process? What is happening with your sleep? It's also lifestyle deficiencies. You see, a lot of people are now moving away from alcohol. which is great. But they're thinking, if I don't drink, if I don't smoke, I'm a healthy person. My lifestyle is great. Not necessarily. How much time you spend in front of not television, okay, you don't watch television, but how much time you spend with the social media, how much time you scroll, how much time you spend on the phone talking to your friends even. You would think, oh, I have fun talking to friends. No, you're still leaking your energy. How much time do you have when you have complete silence, when you completely in a hermit state, when you collecting your dopamine and holding it? The dopamine deficiency is the one that leading problems today. ADHD, Parkinson's disease, dementia, you name it. Because we're constantly hyperstimulating ourselves and trying to push and pull that dopamine receptors, stimulate the dopamine receptors and pull dopamine into ourselves. So that's lifestyle. How many thoughts you have? Inflammatory thoughts. Inflammatory food is one thing. What about inflammatory thoughts? Thinking, oh, what did she say? What did she do? That creates cortisol right there.
And the instant and the chronic negative news. All the
Exactly. Watching
time.
TV and all that. Imagine,
Yeah.
like, you open a TV, you watch, it's just crazy. Or even movies, you watch movies, there's always drama. And rightfully so, because you wouldn't go and watch quiet, normal, peaceful lifestyle. It would be a boring movie for you, right? Why? Because you want that dopamine in your system, overstimulating yourself. So that's your lifestyle deficiency. And then activation, not understanding your genetics, not understanding how you build, and thinking, oh, I was advised, or I saw that on Instagram, someone said that if you eat this or you take this vitamins, it's good for you. Let me buy that. Let me take it. I'm taking care of myself, but I'm still not feeling energy, but at least I'm taking everything. And this is when the people come to me saying, I'm exercising, I eat right, I'm healthy, I don't drink, I don't smoke, I take vitamins, and I don't have energy. That's because one of those three pillars, or all of them, are misunderstood and missing.
Absolutely. And people do this, fasting, like, oh, I did a 1-day fast or a 3-day fast, and thinking, okay, I'm solving all the problems. Or I don't eat, I eat only once a day, and I'm still not losing weight. I'm like, okay, well, first of all, you're not getting all the nutrition that you need. You cannot have enough protein or any vitamin, for that matter, in one meal a day. And second, if you eat only one meal and that's at night, for sure your sleep, it will not be a good quality sleep. And especially when I hear, oh, I'm lucky if I get 5 hours of sleep. I'm like, this is not about luck. This is not optional. Sleep is mandatory, because that's another inflammatory factor. When you don't sleep well, you're inflamed. When you're inflamed, you cannot lose weight, period. And the more inflammation, the higher your insulin resistance, the higher the resistance to losing weight. It's a vicious cycle. People just grab information from wherever, and when they say, oh, I've tried everything, and they still don't get anywhere, they feel lost and stuck, they come to us. And it would be wonderful if people would come sooner, before something happens or before feeling so stuck and lost.
Yes, true. That's true. Yes. Yeah, the body's always whispers first in form of symptoms and discomforts. We tend to just numb it, just not to pay attention to it, and thinking that it's okay. And then it gives you louder symptoms, maybe a louder pain, and you're still ignoring it. And then finally it slaps you with diagnosis. And unfortunately, in some cases, like you said, it's too late. Yes, you're right. Yeah.
And of course, we made some mistakes, right? We tried to push and pull, because first of all, women, right, tend to try to do everything possible and try to please everybody and try to perform all their duties, and then you crash. But we learn from our mistakes, at least, and we adjust to new ways of life, and it shows. Oh, it shows.
Yes. I'm going to pause now. I'm going to pause because the sun is setting. So, GLP-1, what is this?
It's a wonderful hormone. it's a wonderful hormone that we produce. It's just that it's not measurable. And this is supposed to control our appetite, slow down the digestion, the transit of food through the stomach, and help us balance that sugar level. And it has receptors everywhere. It protects our brain. It protects our heart, blood vessels, pancreas. And the problem is that it is produced in the intestine, in the gut. And a lot of people, because of poor food choices, because of antibiotics courses, because of maybe antacid medications for years and years, different reasons, they have not enough, they don't have enough GLP-1 production. And when they start gaining weight, they are offered in traditional medicine the GLP-1 mimicker, which is the injectable medication. And this actually, when they did the research on GLP-1 injectables, they did not do any studies as to what happens to our own GLP-1 production when we receive these injections. But the common sense, the usual way things work is when our body is given something, it says, oh, okay, I have enough. I don't need to make any. So it's a negative feedback. And again, we don't know that for sure. It's not proven, but it's interesting that people that are on injectables, if they stop, they gain the weight back and more. And because they lose muscle mass along with fat, they gain this weight on top of less muscle, which is, much worse. And most people on the injectable don't feel great. There are a lot of GI side effects. There are a lot of fatigue, and some people with depression. I've heard of people that had to take days off, like every Monday and Tuesday, they were taking days off of work because they had to have the shot on a weekend, and that was still not enough to recover. Why would you do that to yourself? There is something natural that you can do to stimulate your own body's production of GLP-1 and increase that 200% and help your body do what it was always intended to do, meaning have your own GLP-1 activate all these receptors everywhere and actually protect your pancreas, protect your brain, improve memory and mood, not make you worse, cardiovascular protection. And then it doesn't have the GI side effects like the chemical mimicker because it's your normal hormone. So sure, you're going to feel full for longer, but it's a good thing, actually. It's normal. So, and all that cravings, the tug of war in the brain, I want this, but I should not have it, but I'll have just a piece. All that goes away when you have the right amount of GLP hormone, GLP-1. And I think, there are people that they have stable weight, they can eat okay, and they don't gain weight. They don't have cravings like that, many. So it may have something to do with that. We don't know. Again, no research in that field, but it's interesting. It's interesting.
It is. And you're right. You're absolutely right. I agree with everything you say. And I deal with patients a lot who come in, who are placed on Ozempic or Mounjaro, which is more popular today, Mounjaro. And they just say, I can't do this. It gives me such a fatigue, even if they don't have nausea, even they just have fatigue almost to the point that they depressed. Literally last week, I had a patient who called me saying, I can't do this anymore. I feel like, yes, I'm losing weight, but I have no life left in me. Another patient, a couple of weeks ago, she called me and said, I want my orgasms back. I have no energy. I don't want to have sex. Libido is out. I want my life back. You see, besides the fact people who actually, we have one patient like you said, there's also the mental component to it. She's still on it. We're trying to take her off. Hopefully one day we're going to. We slowly, gradually bringing it down. But she takes her Mounjaro and then she pukes for 2 days straight. She just vomits,
Wow.
vomits, vomits, vomits. But she agrees to take that risk or side effect because she's losing weight and she's scared to stop it because she's scared to gain it back. So it is obesity or weight, not even obesity, it's just a weight. It is not only physical component, but it's a mental component. And it's a big role in that plays, I think, in that the whole body system between your gut and your brain. We know that we have so much bacteria that live in our body. It's, genetically we outnumbered. If our
Yeah.
genetic pool is 25,000 genes, bacterial pool is what, 2.5 million or so.
Yeah.
So we
Hmm.
outnumbered. So they actually think for us. They make us crave things. So if you have that pathological or like bad bacteria, we call it, in your body in a big huge amounts because you fed it with probiotics, which is food that bacteria loves, it will be asking for more sugar. It will be asking for more processed foods because this is its food and it will be making you go and eat. So it's a
Hmm.
vicious cycle that it's very hard to break. And
Yeah.
you're right. It's very interesting. It's very interesting. And these peptides, the GLP, it's a hormone, I mean, a glucagon-like peptide, which regulates sugar in the body.
Hmm.
And you're right. We produce it. We produce it in our gut. We produce it in our brain. We produce it in our lungs. We produce it everywhere. It's just what affects that. Well, you have to activate production instead of suppressing it. And you're right, when you're taking anything, whether it's hormones, whether it's peptides, there is a possibility of negative feedback. Totally.
Yeah.
And another very important side effect is muscle loss, which is so important, especially if you're in menopause and postmenopause. When you're 65 and older, losing muscle mass, it's important. I mean, it's very dangerous. If you're losing your muscle at 65 and
Absolutely.
older, you basically have a no defense mechanism in your body. That insulin resistance that we were talking about, insulin insensitivity, it happens, majority of it happens in your muscle. The muscle becomes that powerful generator of energy and metabolizer of sugar. And if
Yeah.
you don't have that enough, what happens? The muscle is the one that protects your organs, your skeleton. That's why all these skinny old ladies, they're so frail. And they turn. And my grandma, she just turned and she broke her tibia. She broke her bone just from turning. That's how frail
Wow.
she became at the age of 85, 87. You see? So why would you do something that remove the nutrition from your body? Why would you do
Hmm.
that? Again,
Right.
number one, it's became a big trend. Everybody's on it. Okay. Number two, yes, in some cases, you need to use that. And I use that in some cases on some patients where they have, it's just they so not desperate, but they tried everything. They so disappointed in everything and nothing worked for them. And if I put them on something like that with one condition, it's only going to be for a short period of time while I'm putting all the nutrients in your body and we're developing a system in your body. We're not going to be on it for life. We're not going to be on it for more than 6 months. It's only a crutch when you broke your leg. At this moment, I will allow you to have it, but it's okay. But again, it is not for everybody. It's just for specific group of patients.
Hmm.
Majority of patients who own it that come to me, they own it. When I take them off, I start with the natural GLPs and then gradually take them off. In some cases, within 2 months, in some cases, within 4 months. It depends on the patient. Yeah. It's a very interesting and very delicate topic. A lot of people on it, they don't tell you. A lot of my patients that come just for regular GYN exam, they don't even tell me that they on it until I ask them. And some of them
Hmm.
embarrassed to say it for some reason, maybe
Hmm.
because they know that I'm holistic and so forth. Yeah, it's a very interesting topic today.